Thank you very much. So my name is Rajiv Gandhi. I'm a consultant and I lead the diabetes food service in Sheffield. And I'm going to talk to you today about how I have used the data within NDFA to help me really understand my food service and help me prioritize what I need to do to try and improve things. Um, Next slide, please. But I want to start with a little bit of history. So around the time I became a consultant, about 10, 12 years ago, next slide, please. Um, Bob Young and William Jeffcoat and Naomi Holman produced this paper and this graph, which looked at the variation in amputation rates across the whole country. You can see how old it is because it's referring to PCTs. Um, and where do you think Sheffield was at that time? Well, we were right at the top the left-hand corner. We had the third highest amputation rates in the country. So it wasn't a particularly pleasant place to be when this graph was produced. But I think, and the narrative at the time was that um, uh, the the reason behind this variation was related to lack of MDFTs in areas, etc. But actually, when I came to Sheffield, we had a fully functioning MDFT with all the bells and whistles that NICE would have wanted, and yet we had really high amputation rates. And what that told me was two things. But the main thing it told me was that perhaps amputation rates isn't the best metric to use when you're trying to assess the quality of your diabetic food service. And I think increasingly over the last 10 years, we've recognized that it isn't the best metric. For example, 50% of major amputations generally happen to patients who are not actually known to the Footcare service. They present as acute emergencies. Um, so we know that this isn't a great metric, but I would argue that this graph did help in terms of encouraging every centre, and I'm sure Jerry will tell you now, pretty much every centre across the country now has an MDFT that fulfills most, if not all, of NICE guidance. Um, uh, Next slide, please. So what is the best metric to measure the quality of your food care service? And I think within NDFA, we recognize that this is probably the metric that we should all be using. That is alive and ulcer free at 12 weeks, measured by ulcer severity. And you can see here on this graph that Fran kindly shared with me, that if you have a severe ulcer, only about 35% of ulcers across the country are alive and ulcer free. Whereas if you present with a less severe ulcer, your chances of being healed at 12 weeks are 61%. So I think this is the metric that we're increasingly going to be using to measure the quality of food care services. This is the metric that you need to be looking at for your service. Next slide, please. So this is the NDFA dashboard, and I would really encourage everybody to go and play around with the data on it. I've been using it over the last few months, and I found it tremendously valuable in allowing me to understand what is happening to my service. I know that we've made huge changes in how we run diabetic food services in Sheffield over the last 10 years. And what I wanted to know was, how am I doing? And I wanted to know two things. One, I wanted to know is, how am I doing over time? Are things getting better? Are they getting worse? But also, in order for me to know how I'm doing, I need to compare myself against my peers. So I also want to know, benchmark myself against other organizations. But in order to understand this data, next slide, please. And on this graph here, I've just extracted some of the data from the dashboard. But in order to understand that, you need to really understand what these numbers mean. So when you're looking at the dashboard and the metrics that it's generating, there's a number of things that you need to look at first. Next, please. Sorry, oh, that's gone. Can you go back? My animations don't seem to have worked. Never mind. Um, excuse me. So the first thing you want to look at is your numbers submitted. Um, and you can see here, this is Sheffield's data for 2022-23, and we submitted just over 300. You need to know for your center, is that number a representative number for the number of ulcers that you would have seen over the course of that year? If the numbers is very low, then there is a risk that there is ascertainment bias, because you may be that there are significant variations in how you're collecting the data. Maybe there are parts of your service where you're not collecting the data from, and I'll show you for Sheffield what that means. Um, the next thing you want to look at is the proportion of less severe ulcers that are presenting to your service. Now, we know from the national data that roughly 55 to 60% of ulcers presenting to foot care services should be less severe, and the remainder, about 40%, should be should be severe ulcers. Now, looking at Sheffield's data, oh, sorry, can you go back, please? Looking at Sheffield's data, you can see that only 40% of our severe ulcers presented as less severe, suggesting 60% were severe. Now that would, on the face of it, suggest that there's a problem, because 60% of the ulcers presenting to our service is severe. But what I know is that, next slide, please, is that something happened in the last few years, and that was something called COVID. And as a result, we changed how we ran our service. And one of the things that we did was we moved to a remote advice and guidance service. So a lot of our less severe ulcers were being managed in the community. Now, we don't currently have a system in Sheffield of recording those individuals who are being managed remotely within NDFA. So what's happened is that as a proportion of our ulcers, the less severe ulcers are not being recorded. And so proportionately, our number of severe ulcers looks much higher. But I only know that because I understand what's happening within my local service. So it's really important when you're looking at your data that you have an understanding of what's happening to your local service, because otherwise sometimes the data can be a little bit misleading. Next slide, please. Okay, sorry, I had a number of animations in here and they seem to have disappeared. The next thing you want to look at is your proportion that are alive and ulcer free at 12 weeks. And you want to benchmark yourself firstly against the England and Wales average, which is at the bottom, and of course against all the other centres. And I've identified a number of other centres that are similar in size to Sheffield, and I will show you that data in a minute. But so you can see, for example, for Sheffield, that the number are also free data shows that for less severe ulcers, 65% are healed compared to a national average of about just over 50%. And severe ulcers is about 40%, which is compared to a national average of about 28%. So that suggests that we are doing really well and significantly better than the national average. And for me, that's really important, because I know that that means that a lot of the improvements that I've put into the service are yielding benefits. Next slide, please. So you can see here, I'm now comparing myself to a variety of other centres who are also similar in size and submitting large numbers of patients to NDFA. And I can compare myself to those. And so if we pick, for example, healing rates for severe ulcers, you can see that my healing rates compare very well to many other major centres. Okay, next slide, please. So my animations are suddenly now working. Great. So you can see that. Okay, but the other thing I want to know is, can we just go back one slide again? Sorry. So does that mean that I sit back now and rest on my laurels because my outcomes are excellent and our as good as or better than many other leading centers in the country? Well, actually, you need to remember this is only 1 year's worth of data, and it could be an aberrancy because maybe I've not been recording all of my ulcers into NDFA. So next slide, please. So here you can see I've selected severe ulcers and the proportion alive and ulcer free. And the graph at the bottom shows my trends over the last few years. And it shows that consistently I am getting healing rates of around between 36 and 40%. So that to me is extremely reassuring because it tells me that the results we got this year, yes, they are high, um, but it is not an outlier in that I am getting consistently good rates of healing for my severe ulcers. Next slide, please. See if my animation works. Next slide. Okay. So I know that I'm doing really well, but but I've also been in a place where I had very poor outcomes. Remember, I had the third highest amputation rates in the country not that many years ago. And so I've been where Center 7 is. What does the data for Center 7 tell me? Um, well, it tells me that actually this is a center that's working really hard. They're seeing large numbers of patients. They're submitting amongst the highest numbers of submissions to the NDFA. But their outcomes aren't great, are they? So if you look at the percentage of healing for severe ulcers, it's 24% compared to, say, Sheffield, which is 40%. And you can see, for example, looking at the numbers seen within 0 to 13 days, a metric that Bob mentioned earlier, um, that's down at 40%. So only 40% of their ulcers are being seen within 0 to 13 days. And that perhaps reflects why their outcomes are so poor. Next slide, please. But if I am Center 7, what I also know, if I look at my trends, is that it hasn't always been that way. So just a few years ago, Center 7 was performing as well as, or even better than, the majority of centres in the UK. It was better than the national average. So it had very high healing rates. It was seeing large numbers of its patients within 13 days. But something has gone wrong. And I don't know what that is, but you, if you were at that center, would know. And what you need to do then is to use this data because you will know yourself that there are problems in your service, but you can use this data to improve, identify areas for improvement, be talking to your commissioners and to your managers about what has gone wrong in your service and how you improve your outcomes and how you increase the resource being devoted to your service if it is an issue for, say, around capacity. Thank you. Next slide, please. So Bob alluded to this earlier, but what does NDFA tell us about variation? So if you look at the variation between centres across England and Wales, you can see that from the numbers on this graph that for those who've seen within 13 days, the variation in the numbers is between 5 and 100%. And again, you can see the variations for healing rates of both less severe and severe ulcers. Massive variation across the country. And if you are a centre with numbers down near the bottom of that, you need to be using your data to identify where those issues and problems are, talking to your managers and commissioners, and working out how you and then learning from those centres who are doing much better, and thereby improve your service. Next slide, please. So what have I learned over 10 years of trying to improve my diabetes service? And what I've learned is that what I needed to do and what has helped me over the last 10 years is collecting my data, but then also knowing and understanding my data. but then, and lastly, using my data in a way to improve my service. Thank you.